Welcome to this community briefing on COVID-19 and our city's response. Joining me today is interpreter Margie Propp, and thank you to Margie for providing your services for our community. And thank you all for tuning in. We want to remind you that a great deal of detailed information can be found on our website, covid19.lincoln.ne.gov. That website includes a dashboard with the latest information, and later in this briefing, we will be unveiling some new enhancements for that dashboard. Our COVID-19 risk dial has been in place for more than a month now, also found on the website. And this simple tool helps our community know what actions and behaviors that they can take in order to protect themselves and their families and the health of everyone in our community. The COVID risk dial provides a visual color-coded depiction of what we are experiencing in terms of local conditions and the risk of the spread of COVID-19. Red represents the highest risk of COVID-19 spread, while green represents the lowest. And for each color of risk, we provide specific guidance from our health department regarding physical distancing strategies, face coverings, hand washing, illness monitoring, and disinfection for when we are at home, at work, and in public. We update the dial each Friday based on local data, and the health department team has determined that the risk of spread of COVID-19 in our community remains moderate, so the COVID-19 risk dial will stay in yellow, but it will move to the left, to the mid-yellow range. And the reason for the dial change is that our indicators continue to improve. And this good news comes with a word of caution. The risk of COVID-19 spread in our community remains a concern, and we do need to continue to take actions that reduce the potential for the spread of this disease. And we can continue to make this kind of great progress if we remain vigilant, maintaining at least 6 feet of physical distance between ourselves and others, wearing face coverings when we're around other people, and washing our hands frequently with soap and water for at least 20 seconds. Here in Lincoln today, we have had an additional 14 individuals test positive for COVID-19. That brings the total number of lab-confirmed cases in Lincoln to 1,443. Our total recoveries identified to date is up from 329 yesterday to 330 today. Again, with recoveries, we expect to see more recoveries in the coming month, given that there is a lag time of about 28 days that it takes to establish a full recovery. And most of our cases, of course, were recorded more recently, so we do have a lag time there in identifying recoveries, but we will continue to report those as they are identified. And now, Health Director Pat Lopez will give us an update on all of our indicators and how the determination for the dial change was made. Over to you, Pat.
Thank you, Mayor. The number of new COVID-19 cases reported in the community continues to decline. We had 250 new cases during the week ending May 23rd, and we saw that go down to 146 last week, which ended June 6th. So far this week, we are at 89 new cases. Our capacity to conduct contact tracing remains high. We also continue to see a decline in the overall positivity rate from a high of 9.5% to 7% today. In comparison, the state rate is 12.5% and the national rate is 12%. Our local hospital capacity also remains strong. We have seen quite a decline in the number of COVID-19 patients in our Lincoln Hospital just in the past week, from 41 patients on June 3rd to 26 patients today. This includes 14 Lancaster County residents and 12 from other communities. While our testing capacity remains steady, we have seen a decline in the number of tests completed over the past 3 weeks now. We see 2 reasons for this. First, fewer people are seeking testing. Second, Test Nebraska went from 6 days a week down to 2 days a week in Lincoln beginning June 1st. We strongly encourage people to sign up to get tested if you have symptoms of COVID-19 by contacting your physician or by filling out a risk assessment at chihealth.com or bryanhealth.com. In addition, Test Nebraska has expanded COVID-19 testing to all Lancaster County residents. This expanded testing will begin next week. This schedule is from 8 a.m. to noon, Monday, June 15th, and also 8 a.m. to noon on Tuesday, June 16th at North Star High School. Testing is still by appointment only. To begin, the process is simple with a free online risk assessment at testnebraska.com. I want to mention that we do consider state and regional data when we do these dial updates, but our COVID risk dial is very specific for our local situation and where our community stands with regard to the pandemic. It is a tool to help our community know the steps they should take to protect themselves, their families, and the health of everyone in our community so we can move forward together and protect each other. Lincoln has responded well to the COVID-19 pandemic. We avoided an influx of positive cases early on. We have been able to minimize potential outbreaks to this point. As we are now seeing data trending in the right direction, demonstrated by the information we shared on our new cases. However, as the mayor noted, this is not the time to become complacent. It's exciting to be more active in the community, to have more opportunities to patronize local businesses, and to see more of our family and friends. We just ask that people continue to take the preventative measures we have recommended so we can avoid a large increase in cases in Lincoln. The yellow moderate level on the COVID risk dial includes the following recommendations for the public. Stay home if you are sick, stay at least 6 feet from anyone outside the home, and cautiously expand interactions with others with outdoor activities preferred. Be a hero, wear a face covering. Continue to wash your hands regularly. Disinfect highly touched surfaces and monitor for illness. For those over age 65 and those with underlying health conditions, we continue to encourage you to stay home as much as possible. Continue to rely on help for your needs outside the home from others. As the mayor mentioned today, we are sharing enhancement to the COVID-19 data dashboard. I want to thank Raju Karpaludi and his team for great work on this important tool. The dashboard is refreshed with the most up-to-date data information every day around 3 p.m. Today, you will notice that we have rearranged the layout of the dashboard to accommodate additional data. We have consolidated the demographic information with the new case count in the upper right-hand corner. Here you will find the total case count went up to 1443 today, along with the sex, age group, race and ethnicity, and exposure type, whether cases are travel-related, direct contact, or community spread. You will also see a new data category, cluster cases. This pie chart shows that 45% of all cases are part of a confirmed cluster of 5 or more cases. Clusters are identified based on shared characteristics between cases, primarily time and place. Next, we added demographic data for those who have been identified as recovered. You can see the sex, the age, and race and ethnicity. We have adapted the criteria to best reflect recovery from someone, whether they were symptomatic or asymptomatic. Contact tracers follow up with people 28 days after their lab report date and ask about their health status. Recovery is then defined as an individual self-report during the follow-up call that they have recovered or returned to their normal health status prior to having COVID-19. In the bottom right corner, we have added demographic data for deaths related to COVID-19, again with sex, age group, and race and ethnicity. We previously talked about disparities and how we have seen this virus affect minority populations at an increased rate. In comparing the age groups of positive cases to the age groups of COVID-related deaths, we can also see that disparity and extreme impact on older populations. About 13% of all positive cases are among those 60 and older, but this age group makes up 90% of COVID-related deaths in Lancaster County. In the middle section at the bottom, you will find data about testing and positivity rates. This includes the number of tests completed weekly, the weekly positivity rate, the number of tests completed daily, and the number of positive tests daily. And finally, the data, the daily positivity rate, as well as the overall cumulative or overall positivity rate. Daily numbers are good for tracking. The weekly numbers help in looking at potential trends, and the cumulative numbers provide a more comprehensive look of how we are managing overall. A couple of examples of cumulative data can be found in the lower left corner, with the total numbers of individuals tested, which is 20,318 as of today, and the overall positivity rate of all these tests, which is now 7.2%. The final enhancement we want to point out is the additional tab that has been added to the map in the upper left-hand corner, to compare the number of positive cases and the number of tests completed by census tract. The lighter colors represent fewer cases and tests, while the darker colors represent a higher number of cases and tests. If you compare these maps, they are consistent in that the areas where more people have been tested are also the areas where more cases have been detected.
Thank you, Director Lopez, and thank you to Raju and our team at the Health Department for continuing to make this important information available to our community through a dashboard. We really appreciate this resource. I just want to note before we close that today Governor Ricketts announced that the new grants are being made available to eligible small businesses, livestock producers, and community colleges. Businesses can begin applying for the grants starting Monday, June 15th. The application window closes on June 26th, so we want to encourage those who are eligible to apply right away. For more information, you may go to our website and check out the Business Resources section at covid19lincoln.ne.gov, or you can go to the getnebraskagrowing.nebraska.gov website. So again, for more information, you can check out the Business Resources page of our COVID-19 website and go to the section on state resources, or you can go to the website getnebraskagrowing.nebraska.gov. And with that, we'd be happy to take questions from the media. Do we have any questions from the media today? Well, that's a first. I wish you all a safe and healthy weekend. Thank you for tuning in to this latest update, and we'll be back again on Tuesday. Take care.